Hello everyone, good afternoon. This is Professor Henderson and today I am coming to you with a very simple video on the trach and vent. Thank you so much for tuning in and thank you for subscribing to my YouTube channel. If you like these types of video, continue to like, share and subscribe to my channel. I really appreciate that. So the first question I have here: a registered professional nurse is working as a home care nurse with a 6-year-old child who has size 4.53 connected to oxygen at 3 liters continuously to keep oxygen saturation 95%. The child suddenly becomes agitated and pulls the trach out. What should be the next nursing action? So the correct answer is A, reinsert the trach back into the stoma. So by reinserting the trach, you are creating an open airway and you're preventing the stoma from closing. If that trach does not go back in, you can use the step down trach, which might be a 3.5, and try to reinsert that to maintain an open airway. So all these other choices will be irrelevant if you can get the trach back in. If you can't get it back in, then you will utilize these other steps. The next question I have here: a nurse educator is teaching a level 4 nurse how to change a cuff trach. What actions by the nurse demonstrates for the teaching? The nurse removed the cuff trach without deflating it. So that's the answer. Normally the cuff trach requires the nurse to deflate the cuff. Normally it's inflated with 5 or 10 cc's of sterile water. So you have to deflate it in order to reinsert a new trach. So this nurse will need further mentoring and also remediation. Question 3, a home care nursing supervisor is getting ready to change a 2-year-old child G-tube, 14 French, following protocols from her agency. What actions by the nursing supervisor demonstrates knowledge of this procedure? So the answer is all of the above. The nurse deflates the balloon. The nurse lubricates the new tube before insertion. The nurse checks for placement after tube insertion. The nurse cleans around the somatocyte with normal saline and applies split gauze. So all of these are correct. Question 4, a nurse is working with a 4-year-old child on a LTV 1200 ventilator. The doctor's order states assist control mode. The nurse understands this mode when she verbalizes the number of breaths the child is receiving from the ventilator. So normally a LTV, if a patient is on an assist control mode, the machine, the ventilator is delivering a precise amount of breaths. Question 5. Question 5, the nurse is working with a patient who is on trilogy 100 ventilator with a PEEP of 5. The nurse educator questions the nurse competency when she states PEEP stands for positive inspiratory pressure. So the nurse needs further understanding of what PEEP stands for. The correct answer is A. So PEEP stands for positive inspiratory pressure. That is totally wrong. So PEEP stands for positive and expiratory pressure. So if the nurse states A, the nurse educator will question her competency. She needs to be re-educated. Thank you so much for watching this short video. If you like these types of video, please continue to subscribe to my YouTube channel, like and share, and leave your comments down below. Thank you so much. See you in the next.